Deborah Murphy here. We're at the UCVM Beef Cattle Conference. I'm joined by Franklyn Garry, a professor at Colorado State University. Welcome to Canada.
Yes, thank you very much. It's a pleasure to visit. I should spend more time in Canada. It's a beautiful country.
Oh, I agree. So yesterday you were speaking on scours, and you kind of broke up neonatal scours into two groups. Can you give a brief description of those groups?
Yeah, the point I tried to make to the producers is that many people in the neonatal phase, which means calves from birth or maybe, say, 3 days to about, say, 30 days. That's traditionally called the neonatal period. The most common infectious disease they get is something in the gut. And so calves with any of those problems are sort of lumped together as though they're very much the same. And they are treated as though you're treating much the same entity. What I distinguished between was that group of diseases that I call scours, where the primary sign and the primary effect of the disease is the loss of fluid through the feces, versus those enteric infections mostly caused by a different group of bugs that really damage the gut because those produce different signs, they have a different prognosis, you treat them differently, you expect a different outcome. And so the distinction I would make is between neonatal scours, which is caused typically by crypto, rota, and coronaviruses, so therefore either protozoal or viral agents, versus things like salmonellosis, E. coli, or Clostridium, which are bacterial agents which cause severe inflammation.
So a producer might say, when I see a calf with scours, I treat it the same way. Why do I have to know these differences?
The reason I group them with that distinction between them is because the calves with scours, crypto, rota, and coronavirus, respond very, very well without a lot of antibiotics and require in the treatment protocol really intensive focus on electrolyte and fluid therapy. Whereas the calves that have Salmonella, E. coli, bacterial enteritis may require some fluids, but the fluids are not as important as combating the inflammation. And even there, the outcomes are typically very poor, and so it's important to see that in those cases, you can't expect a really great response rate, and so you really need to double down on your preventive efforts.
So how common are the different groupings?
Well, as a whole, between the two groups, it's the single leading cause of what we call neonatal morbidity, the reasons the calves get sick in that first, say, 30 days of life. And depending on the ranch or the circumstance or the year or the weather or how they manage, that could range from a very small percentage up to 20, even 30% of calves may be affected. Distinguishing between them varies from ranch to ranch because it depends, again, very intensively on management, which is a really important feature. And overwhelmingly, the majority of calves will have scours as compared with bacterial enteritis. But in a given ranch setting, the reason to distinguish between them is because in a given ranch in a given year under given circumstances, now you might have not that much scours, but a lot of the bacterial enteritis, and that should signal that, boy, we need to change something to prevent this in the future.
Mm-hmm. So say I walk out to the pasture and I see a scouring calf. How do I tell which group it belongs to and thus how I should treat it?
What I walked the producers through was a very simple set of physical signs that you can evaluate in the individual calf. From a distance, they'll look very similar because both sets of calves in both groups will tend to have diarrhea. And so if your only discriminator is that calf has diarrhea and doesn't look good, well, then you're not going to distinguish between them. But if you look at the degree of dehydration, which is simple for a person to assess, and you compare that with other signs of illness that would include depression or recumbency or weakness, and you also compare that with specific signs of inflammation, which include things like changes in the mucous membranes, the vasculature, the blood vessels in the eye, whether the calf has a fever, whether the calf has other signs of disease like swollen joints or bad lungs. That's where you make the distinction. And I would argue that a good observant producer is easily capable of making those distinctions once they learn why and how you would look at those particular signs.
And then thus, if it's the dehydration that we're seeing as the main focus, that's where the electrolytes and fluids come in versus the other treatment protocol.
Right. In both cases, there's not one individual sign. If you only look at a sign, like sick calf looks weak, or alternatively, diarrhea, or maybe you said sick calf with diarrhea, then you're not discriminating between these two. On the other hand, if you look at a calf and you say, it's sick, it's clearly not normal, and it's got diarrhea, and it also has an increased duration of skin tint, and it has dry mucous membranes, and it has cold extremities, and it does not appear to have severe inflammation, that calf is almost always going to respond really, really well to fluid therapy, and typically antibiotics are not warranted. In the cases where they are, it's because you might have a mixed infection between the two, and in that case, you're not going to give oral antibiotics, you'd give parenteral or injectable antibiotics. On the other hand, you could have a calf that looks really bad and has some diarrhea, but when you look at it, it's not particularly dehydrated. It also has really bad lungs, and it has evidence of inflammation, which you can detect on the physical exam. That calf you can give fluids to, but it's probably not going to save the calf. That's the disease is much more complicated than just the loss of fluid through the feces.
So if we shouldn't be relying on antibiotics, why is that the first thing that most producers turn to when they see a scouring calf?
Oh, I think that's historical. Back after World War II, when we started using antibiotics, they were so effective against treating bacterial infections that any animal that looked infected got the benefit of antibiotics, much the same as in human medicine. There's an over-reliance on it, which is now we're beginning to turn that corner. So in human and in veterinary medicine, we're saying, well, but this is the common cold in a human, so really the antibiotics aren't going to help you much. But in days not that long past, that would be the first thing people would reach for because it becomes the most common treatment. Same in calves. Producers and veterinarians alike, the first thing they reach for when they see that an animal's infected is, what antibiotic do I use? Even in the face of the fact that many of the diseases we work with are viral diseases, and the bacterial component of infection is actually secondary or relatively less important. Antibiotics are a very important tool. The more we fine-tune where we use them, I'm not an advocate of getting rid of antibiotics. I just think that it's smarter to deploy them where they're needed, not just because the calf looks sick.
More prudent use of antibiotics.
Yeah, that's the phrase. The phrase is prudent use of antibiotics. And prudent use suggests that you have more specific reasons to use them, to choose the right antibiotic at the right time, and to not overuse them and just throw them at whatever. And I'm guilty as charged. Growing up, I would use antibiotics fairly flagrantly. If an animal or a person, myself, got sick, you reach for antibiotics because they obviously work. That's becoming less true now. It's getting a little more heavily scrutinized, and we need to be more cautious. We need to be more thoughtful. And so if we can direct the antibiotics where they're going to be most effective and use them less or not at all where they're not going to be effective, that, by my definition, is prudent use.
So actually treating a calf with scours can be a lot of work when you're tubing with electrolytes every few hours maybe. Prevention is probably a better option. So what can we do to prevent seeing all of these different problems in scours on our farm?
Well, there's a whole series of things, and they are pretty, I think, common knowledge, but maybe not deployed as well as we should. So calving management is critical because the cleaner the calf environment and the healthier the cows at the time of calving, the less the transmission of new infectious diseases to the baby calves. And then housing management. Once the calf is on the ground, then a clean, dry environment, which is that's a challenge in a beef operation, and not mixing animals that have the infection with calves that don't have the infection. This is especially troublesome because there are compelling reasons when weather is bad to put calves someplace where there's shelter. Unfortunately, if you mix calves of different ages and the older calves have the bug and they're shedding it, and you mix younger calves with them because you're getting them out of the elements, putting them in Quonset huts, put them in some kind of confinement to keep them in a drier or cleaner environment, actually that can backfire. So there's these decisions that have to get made between which is the lesser of the evils, how can I design a system that both protects the calf but minimizes the contact. And there are some good management strategies for that have been fairly well described, and they take very thoughtful implementation.
Well, thank you so much for joining us, and come back to Canada anytime.
Okay, thank you very much. I appreciate it. I've enjoyed being here.